Welcome to This Week in Health IT Influence, where we discuss the influence of technology on health with the people who are making it happen. My name is Bill Russell, recovering healthcare CIO and creator of This Week in Health IT, a set of podcasts and videos dedicated to developing the next generation of health IT leaders. This podcast is sponsored by Health Lyrics. Professional athletes have coaches for every aspect of their life to improve performance. Yet many CIOs and health executives choose to go it alone. Technology has taken center stage for healthcare. Get a coach in your corner. Visit healthlyrics.com to schedule your free consultation. 2 new services on the website want to make you aware of. This Week Health Insights is for individuals looking to propel your health IT career forward. 2 emails a week designed to give you insights that set you apart. This Week Health Staff Meeting is for teams, really for managers looking to introduce your teams to new thinking from industry leaders to get the conversation started on the right foot. If either of those 2 are of interest to you, hit the website and hit subscribe. If you're going to be at the health conference in Vegas at the end of October, you're going to want to stop by a discussion that I'm going to be moderating on Tuesday, October 29th at 12:40 with VMware, Deloitte, Intel, and others. It's going to be a discussion on the opportunities, challenges, and promise of leveraging multi-cloud environments for healthcare. If you're there, please stop by. I'd love to see you. We caught up with Dr. Mike Pfeffer, the CIO for UCLA Medical Center, and had a great discussion around physician and clinician burnout just after he stepped off a panel on that same subject at the Health 2.0 conference. Have a listen. Hope you enjoy. All right, another session from Health 2.0. We're here with Mike Pfeffer, the CIO for UCLA. CIO, is that still the correct title, or did you tack on like Chief Digital Officer?
No, luckily still no Chief Digital Officer. So CIO, yes, for UCLA Health. Mm-hmm.
So you just participated in the panel talking about physician-clinician burnout.
Yes.
Really. So let's start where this conversation usually starts, which is at the EHR.
Right.
And you talked about the Arch Collaborative, which we've had from class and others on and talked about the Arch Collaborative. Talk about where you guys are at in terms of your EHR journey and the findings.
Sure. So we rolled out our EHR in 2013, pretty much enterprise-wide. At that time, it was the largest of that vendors go live on a single day. So we were quite proud of that. And then since that time, have been, optimizing, upgrading, doing all the care and feeding of it. When we took the survey, we ended up ranking greater than the 90th percentile for both physicians and nurses in terms of satisfaction. But we still had issues, and being at the top of that list wasn't necessarily something you want to jump up and down about, because overall the net promoter score was still in the 60s. So we still have a lot of work to be done.
You were in the 90th percentile, but your NPS was in the 60s. What do you attribute that to?
Well, I think overall doctors...
The EHR is still a burden.
A burden, I don't know, I think it's different for every single person.
I didn't say that right. So the burden is really the regulatory environment, the fact that you can be gotten to at any time of the day. So
Right.
you can't,
Right.
And you mentioned this, you can't
Right.
disconnect.
Can't disconnect.
You're expected to respond at literally all hours of the day. And we haven't really figured out how to document the meetings real well.
Right.
So people are
Right.
staying an extra hour or so.
Easily. I mean, it's definitely a vessel for everything, whether it's regulatory, billing, communications. It's all kind of the place you do everything now. So you can't disconnect, and so it feels like it's always there, like it's following you around. And while it has lots and lots of benefits, it's still that inability, I think, to disconnect. And then the autonomy issues about, how you have to write your note, kind of all these things. Physicians are creative people. Nurses are very creative. And when we take away that creativity, it really takes away kind of autonomy and purpose, which I think are really critical to reducing physician burnout.
Yes, and maybe to be fair, I was at the Health Catalyst Summit last week. There's a lot of value in this data that we are collecting.
Yes.
We are starting to turn into real analytics. It's really starting to improve outcomes. But when you talk about we're taking away their creativity? In what ways does maybe the normal flow now take away their creativity?
Well, I think as an example, we'll use the billing rules, for example, and how you have to write a note. What that does is it forces people to have to stick to a very particular template that may or may not apply to the situation at hand. The note is really about, thinking through the patient's care and what you need to do. For very simple cases, it may not be that big a deal, but for complex patients, and especially in an academic medical center where you're seeing really complex patients, you need to take a step back and really think through the massive amount of data on the patient and how you're going to put this all together to come up with a treatment plan. So when you prescribe something to be so specific based on billing rules, which have literally nothing to do with the care of the patient, absolutely zero, right? It takes away that autonomy, that creativity, the purpose of the note. And the note is viewed as the only purpose is for billing. And that's not what it's supposed to be about. So I think that's maybe how I would describe the lack of loss of creativity.
So you're one of the physician CIOs. There's a couple of you across the country.
A couple of us, yes.
And so talk about what can we do as health IT professionals around this idea of clinician burnout? I mean, the surface thing is to really understand the EHR. I think the ARCH Collaborative is phenomenal in terms of really giving you those metrics. But what's the next step? Where do we go?
Yeah, I think it's pretty. I think it's a lot of, what really good leaders should be doing, and that's just listening. We can't fix everything. I mean, there's a lot of stuff that's imposed upon us, one by the vendors, one by regulations and everything, but we can still go out and listen. And so we have a physician informatics team at UCLA, a nurse informatics team at UCLA that goes out and listens and tries our best to really understand the things we can fix, the things we can improve versus the things we can't, and then focus on the things that we can improve. And that process is just something we have to keep doing. I think physicians want to be heard, and we have to listen. That doesn't mean we can fix everything for certain. We can't. But the better we listen, that alone, I think, improves things. And one of the things we learned in the ARCH Collaborative when we went through all our data was where we were rated very, very high was in where the IT department felt like a partner rather than not a partner. So I think we really pride ourselves on listening, and we do that through many different mechanisms, but also governance. And in our IT governance, for example, we don't have any IT people leading any of those meetings. They're all chaired by faculty or administrators or both, driving kind of the things we do in IT.
I saw a big sign as I was driving. I drove up from Southern California, and I saw a big sign, UCLA #1.
Yes.
It looked like graffiti because it was painted on the side of a building, but that's the way billboards happen in LA. What are some things you're doing that you're really excited about, just maybe outside of this topic of burnout?
Wow, I mean, there's so many really exciting things. I would say precision medicine and really thinking about how to actually use artificial intelligence and gearing up for what that's going to look like. So, it's one thing to sequence someone's genome. It's another thing to say you have an algorithm for whatever. But how do you actually integrate that all together so that it's delivered to the physician in a usable way? And we've been doing a lot of work thinking through how to do that. So whether it's capturing discrete genomic data in the electronic health record so we can not only use that for decision support, but also use that for data mining, combining that with our precision medicine program, which we're calling Atlas, and then figuring out how to incorporate more social determinants of health, I think is really, really exciting. We've also really put a lot of work into our cloud analytics platform, which will have the ability to ingest AI algorithms to be used in real time in the electronic health record. So those are some of the things I'm really excited about as we look into the future of where health IT can be beneficial.
I've joked that it's like signing day. Every now and then I'll pick up, Mayo just signed with Google.
Yes,
it's a big announcement. Who's your cloud partner at this point?
So we have a strategic partnership with Microsoft.
Okay.
Yeah.
So you're moving stuff up into Azure. You're utilizing their cloud and AI. Can you give us just a quick, what kind of tools are available in the cloud that you wouldn't necessarily have on-prem?
It really revolves around the ability to scale our compute environment quickly and pay for only what we need to use. I think one of the things that is really going to be transformative in health IT is the ability to leverage the cloud for much more than we can right now. So for example, I have a disaster recovery data center that just basically sits there, but I need it because we can never have a sufficient, a long downtime, right? But that's the kind of thing that eventually could be migrated to the cloud. So the more we learn about how to use the cloud and scale in the cloud, the better. And also we need the vendors in health IT to be able to support that. So a lot of them don't. And that is limiting our ability to take advantage of that. And again, anything we can save in terms of the compute, which is going to continue to grow in need, we can put back into some of the more transformative technologies in health IT to help our providers.
Fantastic. Thanks for taking the time, Mike.
Absolutely. Pleasure.
Always a pleasure. Thanks.
Thanks.
Gosh, I really appreciate Mike's time, and I really appreciate his perspective. When he said that clinicians are creative and they need their autonomy restored, those are two phenomenal points to make in this physician burnout conversation, and something we need to stay focused on. Please come back every Friday for more great interviews with influencers. And don't forget, every Tuesday we take a look at the news, which is impacting health IT. Keep your feedback coming, bill@thisweekinhealthit.com. It's all really helpful, good, bad, or indifferent. It helps us to make a better show for you. This show is a production of This Week in Health IT. For more great content, you can check out our website at thisweekhealth.com or the YouTube channel thisweekhealth.com, and go to the top right, click on YouTube is the quickest way to get there. Thanks for listening. That's all for now.